Good morning and welcome to Rising. We have a superb show for you today, Robbie. I think this will be the one we package up and send in for the Emmys. What do you think?
Are you setting expectations too high? That's the question I'm asking.
Can YouTube shows get an Emmy?
They should, or is it called like a Tubi or something?
A Tubi. Maybe we'll send this in for a Tubi.
There is an award. There is some kind of award like that.
There's also the programmatic stuff on thehill.com. So maybe there's an award for that.
Webby. They're telling us Webby.
Send it in for a Webby.
Do you have to submit like hours of footage for a Webby?
Imagine being the judge for that.
Oh, God Almighty.
Well, I hope they enjoy this one.
Yes.
Because we're sending it.
Superb. Ryan promised. Pennsylvania House candidate and advisor to the National LGBT Chamber of Commerce, Jonathan Lovitz, is here to weigh in on the Sunshine State's so-called Don't Say Gay bill and others like it cropping up nationwide. Then host of the Bad Faith podcast and former Bernie Sanders press secretary, Brianna Joy Gray, will join us to discuss the truckers aiming to block the Beltway like a, quote, boa constrictor.
Did you see any on the way in?
I didn't see any, although I'm wondering if this giant light, it's like a mobile lamp post.
Sounds like
they
a tactical light.
Right outside my window, and I'm wondering if it's because they're going to need to see at night to move the trucks or something.
It could
be unrelated.
Yeah.
You suggested, before the audience was watching, you suggested I shoot it out with a BB gun.
Yes, I did. I didn't really mean it, though, now that we're on the air.
No, I would never do that.
There are
no.
700, and National Guard has been called up. There's 700 guardsmen and women that will be headed to D.C. as part of this, plus I think they said 50 tactical vehicles or something like that. But that's the problem when you build your protest off of one that just happened. The authorities aren't going to be caught by surprise like they were in Ottawa.
Right. So who knows? And it could end up being less than what they're expecting. Probably won't be more because they seem really ready for this.
Right. They're expecting everything and everybody.
Well, after the Capitol stuff, not going to take the city by surprise again.
We'll see.
We will see.
Right now, however, we want to focus on the Centers for Disease Control and Prevention. The agency had admitted to withholding large portions of COVID data, including information on vaccine boosters, and fears that the data will be misinterpreted. The sampling data represents only 10% of the population, according to the CDC. So according to the New York Times, the CDC has only published a small amount of data over its collection the past 2 years. A CDC spokeswoman said the data, quote, is not yet ready for prime time. No rush. The Times notes that when the agency published the first significant data on the effectiveness of boosters in adults younger than 65, but left out the numbers for 18 to 49-year-olds, obviously a huge portion of that population. It's not the only data that the public hasn't seen. Last year, the CDC repeatedly came under fire for not tracking vaccinated people infected with the virus. Agency officials say the data is there, but has not been released because they may be interpreted as the vaccine being ineffective. Wouldn't want that.
Just give it to us straight, Doc. Like, just give us, stop trying to spin us. Stop trying to, well, if we tell them this, then what? Stop trying to game it out. These people are not, psychological theorists. They're just,
they're not.
They don't know how the public will take information.
If they were theorists, like on that level, they should all be fired because they didn't actually successfully.
Whatever they have done has helped fuel a vaccine-resistant movement.
And you've talked about how they did the testing thing the same way. They were reluctant to approve a lot of these tests because they were worried that there might be some false negatives, and then people that felt as if they had symptoms might still go out, or if it was hard to actually reason all the way through their fear about having too many tests.
Their actual fear was like a bureaucratic fear of losing control of this. No, we want to be in charge of this. What if other people are doing things? We don't like that. We don't like when other people do things. We do things, not other people.
It's a huge lack of trust of the public. It was an inability to say, you're all adults, except the ones who aren't adults. Here is all the information. Be responsible, because if you're not, you or your loved one could die. Like, that really should be enough. And as you saw early in the pandemic, before the CDC was even telling people to mask up, people were masking up because they saw on the news that people were getting ventilators stuck down their throats. And we're like, you know what? That doesn't sound good. I'd like to avoid that.
Right, and they knew that Asian countries do that. They knew before the public health officials.
Right, the CDC, when they originally were like, oh, masks don't work, it's like, then why are all these Asian folks wearing masks?
Right.
And why do doctors and nurses wear masks in hospitals?
I mentioned this on the show yesterday, I think, but there's great information in Scott Gottlieb's new book about the pandemic response, about how the CDC was just utterly myopic from the beginning about data collection, about collecting the right data and making it available to the right people in the White House task force. Deborah Birx, in particular, was just like furious with basic incompetence on their part, and that they had to basically just do it. Though the White House task force had to do it themselves, had to figure out a system for getting this information because the CDC was just obstinately in the way.
It was so frustrating early on and throughout the pandemic that you kept getting statistics about how effective the vaccine was, and that was encouraging. That's why I took the vaccine. But they would never give you a statistic about what immunity from infection was doing when it came to resistance to a future infection. Like, people are still going to get the same number of people would still get the vaccine. Actually, probably more if you treated them with more respect along the way. So, because then it doesn't become an us versus them. What are you hiding? It's like, we're not hiding anything. Here's all the information. Prior immunity is effective, and the vaccine is effective. You get prior immunity, it's a chance you die from that. So go for the vaccine because less chance you're going to die from that.
They think we can't handle the truth, and as a consequence, fewer people trust them. Trust them. So meanwhile, UVA Health is now conducting a nationwide study to find effective new drugs to treat COVID. The study will use 15,000 participants to test the efficacy of Fluvoxamine, an antidepressant, don't know if I said that correctly, and Ivermectin, everybody's favorite, a pill used to treat parasitic infections, not just in horses, but in all sorts of people, animals, etc. Researchers at UVA said the reason the two drugs were chosen is because there have been signs of helpfulness. The antidepressant works as an anti-inflammatory, while researchers said ivermectin shown to stop viruses from replicating in lab petri dishes. So,
that's
look,
true.
It is true. I try to be very careful in what I say about ivermectin. There have been a lot of studies in other countries, and they have shown a range of effects, and these studies range wildly in how credible and how good they are. And it looks like on net you can kind of see a very, 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 very slight positive effect. What some people have theorized is that's just because it's killing the parasitic worms that people have, and if you have worms and COVID, the worms are making it harder.
Some small number of people have worms.
Right, and especially in places where they did many of these studies, making it harder for you to fight COVID, so if you kill those worms, so it will indirectly have a positive effect. It could be the case that there's some positive effect beyond that. I don't think there's really any large chance we will discover that ivermectin is some kind of silver bullet for COVID, because you have had people in this country taking it, a lot of them, and you would know by now. We would have seen good results from people just kind of taking it over the counter from a doctor. But look, we should absolutely test if it helps a little bit, if it helps in combination with the other drugs, with some other combination. Absolutely fine, perfectly fine to explore it. It's not a dangerous drug. It's when prescribed in appropriate doses. So I'm fine with people studying it.
Yeah,
but I don't think they're gonna find. You're not gonna find that it's some kind of magic cure. They're just not.
But I think that's the key there. When prescribed by a doctor and the human version is used, it's not harmful. Like, as long as it's taken properly. And if something isn't harmful, and there's a chance it could, even the slimmest chance that it could help, and the doctor prescribes it, go ahead, try it. Vitamin D and zinc are not silver bullets either, but they're also not going to harm you.
Right, they're good to have anyway. You should have more vitamin.
Give it a shot.
Yeah,
give it a shot, and it probably does help somewhat in some people. And so if it actually works in combination with this antidepressant, great, wonderful. We don't know how these things interact, and that's why science is an evolving process. There have been, like you said, in petri dishes, this showed some promising signs. Lots of things show promising signs in petri dishes that don't end up working. We don't completely understand why that is. But if there are promising signs, continue to study it. That's all we ask for. I don't believe Dr. Malone and some others have said that vast numbers. It fluctuates the number that he'll put on it, but vast numbers of people would be saved if only hydroxychloroquine and ivermectin would have been distributed early. And he says that they didn't do that, not because it wasn't effective, but because it was effective, and the powers that be wanted to make sure that there was a vaccine-only response. And there's just not evidence for that.
I mean, so many people who have gotten COVID and taken ivermectin have died.
That's true.
Like, It's clearly, we would know by now, it would be obvious that, all those people who tried out hydroxy or ivermectin, they had good results. That's not the case. But maybe, that's not to say maybe those things don't help. I think it seems more likely that ivermectin than hydroxychloroquine might have some.
Yeah, and hydroxychloroquine, there was a run on it that was hurting
Right.
immune-compromised people who actually really did need it. And there was so much less evidence for that.
Yeah.
And also taking it prophylactically is like, if 9 billion people can't take that prophylactically,
Right.
like, it'd be gone.
Right.
And then people who have lupus are like, I can't get.
Do you remember that one woman who killed her husband with
the poor lady with the fish tank stuff?
And then tried to claim it was because Trump misinformation had caused her to do it, or had caused
right, because they misread the label.
She clearly just murdered her husband and used that as an excuse. That's the subtext. Sorry, allegedly, not clearly, don't know for sure. The subtext of that story is.
So she was like, Trump wants you to take this.
Yes.
Drink this fish tank stuff. And then blamed misinformation.
Or she just slipped it in his food and then later was like, oh yeah, we took this stuff because we saw it on the news and et cetera.
Incredible.
It's kind of a funny story.
That's like Trump said of Putin. It's clever.
Indeed. Well, we'll be back to tell you what's on our radars in just a minute. Stay with us.